Hey guys, how's it going? So sorry for the wait. I know we had a big gap between the last video and this one, but I wanted to do a little bit something differently this time. I want to make this video geared to both people who are not very familiar with a radiation oncology setting and also people who are a bit more familiar. I want to have something interesting for both audiences. So this episode will be an interview with one of the radiation therapists here, Brett Tilley. Uh, he's a great friend, and we had a great time in the interview. I hope you enjoy it. So, I wanted this interview to be more of an introduction of what a radiation therapist does and how they see the clinic as they're one of the most fundamental levels of a radiation oncology clinic. So, usually the therapist will come here to the patient waiting area, will get the patient, call them out, and then they will walk them until the treatment vault. So we'll walk together. So again, patient waiting area. We'll come here to the treatment machine where the patient is going to get treated. And let's open the door. This is where the radiation therapists sit while treating the patient, controlling the linac and controlling the imaging setup. And they will get the patient all the way set up on this couch. So I want everyone hopefully to kind of get something enjoyable, something valuable from this interview with Brett. We both had a great time. So depending on whether you're familiar with a medical physics environment or a red onc environment, or this is something new to you, or maybe you're thinking about a career as a radiation therapist or as a dosimetrist or as a medical physicist, I hope you find something valuable in this video. And let's just jump straight into the video. All right, I have Mr. Brett over here. Thank you, man, for agreeing to this interview.
Of
And thank you
course.
for your
Thanks
time.
for asking me.
Yeah, absolutely. So I wanted like just to kind of have a conversation about being a radiation therapist, how what this job entails, just because it's kind of unknown to many people,
Hmm.
and especially that it kind of you need to go into it when you're really young. You have to hear about it when you're really young, and it's kind of very difficult. Like it's it's people go into it right after high school, and at least like in my experience, it's very rare to hear about radiation therapy even at
Hmm.
this age. So this is kind of why I wanted to make this interview to kind of just publicize it a little bit more. So can you just kind of give just a small introduction about yourself? You can pull the chair a little bit
Yeah,
closer.
of course. My name is Brett Tilley. I work here at Stephenson Cancer Center. Um, you're right. This field is a little bit kind of unknown per se, as far as even in the medical field goes. My story, how I kind of learned about it, got into it after high school. I knew I wanted to get into the medical field somewhere. I didn't know where. Didn't really necessarily want to go to school for as many years as it would take to be a doctor, or do residencies, all those kinds of things. So I just took some general classes at a smaller college just to kind of get some undergrad classes under my belt. And then a lot like many people that go into this field, you kind of hear about it because you knew someone that was doing radiation therapy, or or you have someone in your family that has cancer and is going through
Mm,
radiation therapy. And my mom was diagnosed with breast cancer when I was a freshman in college. And so
okay.
we actually had a Sunday school teacher when I was growing up that he was a radiation therapist and then went
Oh,
into dosimetry back whenever you could do kind of on the job training.
yeah, yeah.
Your radiation therapist could do on the job training, and then as long as you pass your boards, you could do dosimetry, no additional schooling and
Mm,
all of that. So he kind of went that route. Well, anyways, my mom got radiation therapy treatments in Stillwater where he was working as a dosimetrist. And so he
gotcha.
let me kind of come and kind of job shadow the therapist. They showed me what they did. He showed me what he did as a dosimetrist. And that's how I learned about radiation therapy.
Gotcha.
So that's kind of
So
how I got into the field. Yeah.
you said you learned about it first year of college,
Mhm.
right? When you were a
Mhm.
freshman in college. So you didn't know, like you went into college not knowing that you
Correct.
want to be a radiation therapist. So what, because I know, kind of everyone's route into getting into the field is a little bit different.
Mhm.
What, how did your plans change after? Did you do like kind of just take prerequisites for the
Mhm.
like the next year, your sophomore year, and then kind of continue to be a radiation therapist? How did it go?
Yeah, I kind of went into college just kind of keeping my options open.
Mm-hmm.
Like I said, I knew I wanted to do something in the medical field.
Okay.
I really had no idea of what. I just was kind of hoping something would, something would present itself.
Yeah, yeah.
So I was taking the prerequisites just to get an associate's degree, so I could kind of move whichever direction I wanted to.
Gotcha, gotcha.
And that's whenever I learned about radiation therapy. So then my sophomore year, kind of got to tailor a few classes what I needed to get the prerequisites to try to get into this program here at OU.
Gotcha, gotcha. Okay, okay, okay. That makes sense. So, how would you say? I mean, how long have you been a radiation therapist?
I graduated from the program here in 2012, so
2012.
it's I'm hitting year
So
11
11
now.
years.
Yeah.
Okay, okay, a long time.
Hmm.
So, what would you say? Kind of, how did your views about both the field and also cancer in general change? Brett 2011, 2012, when he was just getting into the field
Hmm.
versus now 11 years deep into the field. How did your kind of mentality change about how you view, well, our work, in delivering radiation to patients and also just cancer in general?
Hmm. So I'll say the one thing that stuck out to me when I got to do the job shadowing when I was going through school and my mom was going through treatments, the one thing that stuck out to me was that radiation therapy field is kind of unique in terms of patient care. I'm sure there are others out there like it, but for the most part, a lot of the medical fields, if you're X-ray tech, nuclear medicine, like all these kinds of things, radiographer, you're going to see the patient once, maybe a couple times, and then you film the patient. They're kind of on their way to the next stop in their care.
Mm,
Radiation therapy, we can treat, we can see somebody up to 40 times,
mm,
45 times, and so you really get to see the patient day in, day out, build a relationship with them,
mm.
kind of help them through their journey, this part of their journey and their cancer care. And that's what really stuck out to me. Is like the patient care aspect is you get to develop relationships with the patients, which I thought was really cool.
It's
And
not a one thing. It's not one
right,
and
it's
done
not like
and you're
yeah,
good.
yeah. And so I really liked that aspect about it. And so when I went to school, the thing that I noticed about there's a bunch of different kind of clinic settings as well.
Mm,
Some clinics are more specialized in areas of the body they treat. Some clinics kind of do anything and everything, like
mm,
OU here. And there was something about OU. This was my first rotation when I was a student. I knew absolutely nothing. Everything was just over my head. But there's something about this place or this kind of setting that there's opportunity. There's a lot of room for growth, a lot of room for learning
mm.
that really just kind of caught my attention and attracted me to want to work at a place like this. I didn't
Gotcha.
get to right out of the gate. I
Oh,
got a
really?
job at a smaller clinic. Yeah,
Okay.
and although there were positives about that as well, I kind of got to see the whole picture. I did the simulations and the treatments, and it really helped build a great knowledge base for me as a therapist, kind of seeing everything about
And also
the
seeing a
entire
different
patient's care,
place, right?
seeing a different place. And then when I was finally able to get hired on at OU, like I said, I had that really good foundation of knowledge about therapy, and then just got to build on it here, just because we do all kinds of treatments, all kinds of treatment sites, and all those kinds of
Different
things, different
modalities, just a
modalities, different
bigger place overall.
technologies. Yeah.
Gotcha. So how you talked a lot about like how, going in, was kind of your mentality. Do you still, how has this changed? Do you still have the same exact, I mean, I'm sure you still kind of appreciate the same way that the kind of relationships with the patients that you build.
Hmm.
But did was there anything that you kind of realized over time in those 11 years that you didn't kind of catch in the first few years of working as a radiation therapist? Was there something kind of that you, time was necessary for you to learn?
Yeah. I'll kind of make a little spin on it here.
Absolutely.
For me
Make all your
personally,
spins.
yeah, for me personally, I do love the patient care aspect of it. That you get to, be have a relationship with these patients that come in, and you get to see them multiple times, and it's cool. They remember you. They come back for a follow up, and they want to say hi, and
Mm.
all those kinds of things. You kind of get to follow them after their care a little bit, which I really like about it. For me personally, and this was something that I really can't even pinpoint a time when this kind of passion was created in me, but leadership is a big passion of mine.
Mm.
And so, probably around my second, third year here at OU, I started seeing this how I could become a better leader.
Mm-hmm.
Maybe not even having in a leadership position, just being a better leader for my coworkers, and just kind of realizing first off how important patient care is and the people on the front lines are.
Mm-hmm.
And a passion that kind of developed inside of me is, okay, how can I provide for my teammates and help them be in an atmosphere that they can give the patients the best care possible. Not saying that I don't want to give the patients great care, but it's like, how can I help my teammates
Absolutely.
feel supported so that they can give the best care possible to the patients. And then when I was able to move up into like a supervisor position, lead therapist or supervisor position, that kind of is the job. I feel like how I want to do it is like, okay, the team that I'm working with, what can I do for them so that they don't have all these other worries about all of the logistics and everything going on behind the
Yeah,
scenes.
you
Like,
take care of
they
that.
can focus on the patient. I'll take care of that. They can focus on the patient. And so that's kind of how I would say for me therapy's developed, as far as I came into the field and I needed to learn as much as I could, learn it all.
Mm.
I came to OU and I was like, I want to rotate to every machine. I want to learn everything that we do. I want to be really
The best therapist you can.
the best therapist I can be. Yep, learn
Mm.
everything I can. And then it's like, okay, now kind of transitioned into how can I support my teammates to do that
Mm-hmm.
same thing.
Absolutely. It's very interesting that you mentioned this, because at least I'm on the physics side of things. I mean, I'm still starting off, but I definitely feel the same way in regards to when I first entered. I thought it was more, working in cancer, it's all about the patient, and it's still all around about the patient.
Mm-hmm.
But at least on the physics side, you don't get to interact with the patient as
Mm-hmm.
much as you guys do. So a lot of the fulfillment you get in medical physics is being able to help your team, is
Mm-hmm.
being able to be there for for another physicist when they need help.
Mm-hmm.
They can ask you for help, or you're just able to provide the support that they need, especially when it's not expected. So it's definitely interesting that you mentioned this, that because at least you're in the very front line.
Mm-hmm.
So my expectation was it's all about the patient, which I mean it still is, but it's interesting that you mentioned that how fulfilling it is also for you to help your teammates or
Mm-hmm.
help your coworkers.
Yeah, I mean that makes a lot of sense. Especially from a physics perspective. I'm not a physicist, or I don't know exactly the ins and outs of what all you guys do, but I mean you're exactly right. Kind of those behind the scenes jobs, like those are hard jobs, because if you do a great job, no one really knows. You
Mm-hmm.
know what I mean? Like, if
Mm-hmm.
if you do a great job, everything's going smooth,
Yeah,
and
yeah,
it's like you did your job kind of behind the scenes, and everything's going
yeah,
smooth.
yeah, yeah.
And so that's
You
kind
don't
of
you don't get the donuts and the cookies from the patients.
that's true.
We only take the leftovers,
No, yeah, that's
I'm
true.
joking.
No, that you're right, and um, that's I don't think it can be understated how important that job is in the
Mm-hmm.
clinic,
Mm-hmm.
because if it takes everybody, it takes an entire village to bring the patient excellent care, and we all kind of have different aspects of that, whether it's like you said, front lines, we're directly interacting with the patient, or it's behind the scenes, kind of making sure everything's checked, everything's perfect, everything's just you know we're so picky around here, and we want everything to be perfect because it's
Yeah,
people's lives at stake, and
absolutely.
the
Rightfully so.
yeah, and the importance of behind the scenes work, and all the planning and tests and QAs, like that can't go understated for sure.
For sure, for sure. But I will say at least, and this kind of leads me to my second question, which is who would you
Only on question number two,
huh?
huh?
I don't know how this is, maybe not today, this is 4 or 5, I don't know. But who would you recommend this kind of job for? Because in my experience, both in, I would say, in physics, but especially
Mhm.
in radiation therapy, I would say, I mean, you kind of thought, oh, physics is hard. I think radiation therapy has a, being a therapist has a very tough component that I would say a lot of physicists actually struggle with, which is you don't just have to be have good social skills. You don't just have to be a good people person. You have to be excellent, right? Because you're dealing with people at one of the worst stages in their lives, right? So you have to be just hyper aware, hyper emotionally
Mhm.
intelligent
Mhm.
when you're dealing with the patient to be a good radiation therapist. Um, so I think that makes it a little bit tough. That's kind of just my view being on the physics side. But how do you think about it? Who would you recommend this field for? Because it's definitely from my just kind of superficial view, it's not for everyone. It's
Mhm.
definitely not for. It's a very fulfilling field.
Mhm.
It's not for everyone.
Mhm. I would agree with that. Um, I think I think you mentioned it. Maybe the most important aspect may be emotional intelligence,
Mm-hmm.
um, because of yes the interaction with patients, and it's it really does help the patients care because we're seeing the patients every day. So
Mm-hmm.
they come in, and that's another good part about building a relationship with the patients is if you do a good job about building a relationship with the patients, you can tell okay they're having an off day. Why are they having an off day? Are they not feeling well? Are they having side effects from the radiation? Are they depressed? Are they
Mm-hmm.
all these kinds of things? And if you can pick up on that, you can use those resources that we have at a clinic setting like this,
Mm-hmm.
which is another reason why I love working here.
Mm-hmm.
Because, in addition to technology, in addition to different disease sites, in addition to multiple doctors, we have other resources across campus that, are at our fingertips. So we have social work
Mm-hmm.
and, if they're, like I said, if they're depressed or if they, maybe they can't afford gas to get here,
Mm-hmm.
and so I think having emotional intelligence to be aware of those situations and caring enough to kind of dig a little bit into maybe what's going on,
Mm-hmm.
you can really help out a patient's cancer care more than just making sure they get the right treatment every day, which is important, but also too that whole aspect. That's kind of what we're going for as therapists. And like you said, so the whole people skills interaction, I think so emotional intelligence, and then if you care about people, which
Mm-hmm.
most of us do, and most people do. Most people care about people. They want people to have a good experience. They want people to be happy. They want that. So I mean, I think that's a good aspect in teamwork
Mm-hmm.
as well, because most of the time as a therapist, you're going to be at least with two people.
Yeah.
We're pretty blessed here. We have the ability to have four therapists on a machine, which is kind of rare, but I've seen most sites have two, three people.
Mm-hmm.
Um, so you're going to be working as a team, and then not only just therapists, but we work with the physics every day. We work with physics residents every
Absolutely.
day.
The
We work with
symmetry.
nurses, dosimetrists, doctors,
Mm-hmm.
and so if you like being on a team, if you care about people and you
Mm-hmm.
want to help people, and then emotional intelligence, kind of like you described.
Absolutely.
I think those are pretty important qualities to have.
Absolutely. Are there any, I mean, you hit a strong point, especially here, which I mean, I feel it even, being still as a student here. I would say that, the social environment here, and even I listened, it's interesting because I listened to people coming from different places. Like Tommy, for example, just came from a different place, or
Mm-hmm.
that we had a trainer coming yesterday, and they say a lot that our social environment here is one of the best they've seen. People who going around different clinics,
Mm-hmm.
and I think you hit on this a little bit also, just kind of being in a good social environment. How important is it for you to be in a place where, especially because you talked about like the leadership skills and being able to give to your team? How do you think, how important was it?
I think it's very important. Working again in an environment like this with a multitude of teams, multitude of people, it really just sets it up to be the best environment for learning, which
Mm-hmm.
is important in life as well as in radiation therapy. If you can just be a continual learner, you're only going to be set up for success. And I come to work every day, and I want to learn. And how do I do that? Is we have just vast diversity here, people from different backgrounds, people from different educations, people from even different like social areas in life, and different perspectives, that leads to
Mm,
different perspectives. And even students, like, I mean, I love to have students back in CT area,
mm-hmm.
them asking questions. A lot of times, they're going through school, things are fresh in their mind. I'm learning from them just as much as they're learning from me. So it's just a great, if you have that attitude and that mentality of what can you learn and what perspectives can you see from others, I think that just breeds an environment of success.
Mm, mm. That's totally, yeah, that makes total sense. Is there anything you feel that kind of what would you say, at least either in the field in general of radiation therapy, or specific to this clinic, that you think is like a low hanging fruit, we can definitely improve upon, we can definitely do better? Is there anything that pops into your mind?
You're talking about from a patient's perspective or maybe an employee's
From both,
perspective?
from both a
From
patient's
both.
perspective and an employee perspective.
Okay. I mentioned on it earlier, we have a lot of great resources here on campus, campus wide. I think in the past, it's definitely we're working towards making it better. But in the past, um, sometimes we do have a busy setting. So
Hmm.
sometimes we're trying to stay on time, and everybody's really good here about being cognizant of, yes, we're trying to stay on time, but we don't want patients to feel rushed. I mean, every single one of our therapists will say that, and it's true. Like, we want people to feel like we care about them, because we do. Um, and then, but when you get in a busy clinic, it's hard, because then if you run late, then the next person's mad, and then they feel like their care is compromised. So it's just constant balance of trying to make everybody feel like they're cared for, and it's hard, it's taxing. um, that can lead to other things. Like I said, we have so many resources even outside of this clinic
Hmm.
that maybe everyone may not be aware of the resources. So even though they are highly emotional intelligent, can tell something going on. They know maybe the patient's, just as an example, they know maybe the patient's depressed and maybe should talk to somebody, but they don't know the resource in social work to get the patient that help, or something like that. Like I said, that's just an example, but things like that. Or maybe we have a head and neck cancer patient that's having a hard time eating, and maybe they need to go to our speech language pathologist that has
Mm,
a lot of swallowing exercises, or a dietitian that can help with maybe their food intake, so their
mm,
calorie intake. They can eat less volume, but higher in calories, and all these kinds of things that can help sustain them through their treatment.
yeah.
So I think that is a low hanging fruit area of just utilizing our resources
Mm.
and trying to go for this kind of complete care for each patient, so that we utilize every area that we can here on campus.
Gotcha. It's very interesting that you actually mentioned this part, because I've been talking, coming in, and I've talked to a few people, at least on the physics side, about this, about kind of mental health services
Mm-hmm.
for cancer patients, and how, I mean, we're in a huge hospital. We definitely have the resources to offer this. There's definitely some people, if not here in the center, there's definitely people just a few blocks away who can offer this, but it's kind of not publicized enough.
Mm-hmm.
It's not offered to the patients
Mm-hmm.
in a very, in a very accessible way. And I totally agree. I think it's a very good point, how kind of, and you can definitely comment on this also from your previous experience, in the
Mm-hmm.
smaller hospital that you worked in. From the people I've talked to, a lot of these services, mental health, or dietitian, or maybe some, like even something like exercise scientist, or someone who can help you
Mm-hmm.
with this, because this is a very very important side of things that can help with the disease that's a lot of times ignored, right? It's kind of not present at all in the smaller clinics. It's already rare in
Mm-hmm.
big hospital settings, but it's almost non-existent
Yeah,
in smaller clinics.
I agree. Just thinking back to my time there, they did a good job of thankfully I've had a great work experience. Everywhere I've worked, people are great, care about the patients. It's kind of, I think you're gonna be hard pressed to find somewhere in healthcare that doesn't actually care about the people, which is good. And so, but you're right. A lot of times the resources are limited. So, our avenue for all the extra stuff that you just mentioned
Mm.
was like, hey, we had a PA on site, and we'd ask the PA like, hey, we're seeing this in the patient. They'd ask the patient, and a lot of times they'd have to like refer them out. So then, that puts it on the patient to have to go somewhere else and seek this care. To where here, and I've actually seen it happen many times. I mean, you call social work, someone comes down and is talking to the patient right then, right after you're done with CT. Same with the dietitians and things like that. You can call someone and they'll be over here, or they'll be talking to them on the phone. So yeah, in a bigger clinic, it's cool to see those resources utilized, and it really does help. It goes a
Mm-hmm.
long way.
Gotcha, 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 gotcha. Do you feel, I guess we talked a lot about the past, kind of to finish it off. How we talked about the past, the present, how things are.
Mm-hmm.
Where do you see, I think there's a lot of both, I will say, especially on the physics side and the symmetry side, there's a lot of talk about, just about just kind of wondering about where the field is going to go in the future, because it's just kind of, it's one of those areas that are, constantly changing, constantly developing. Where do you see the field going from a radiation therapist perspective? Because you guys are always, you're the most kind of fundamental level. You're the ones who interact with the patients. You are kind of the make it or break it level of the pyramid, of a radiation oncology
Mm-hmm.
department. How do you think, or where do you think the field is going kind of in the next, you know let's say 5 years? No, once one
Mm-hmm.
go 5 years, 10 years, do you feel like there is any changes that you kind of have been thinking about, like kind of in the future?
That's a interesting question. It's hard to say. I know I know maybe kind of in the near future. I know kind of MRI and LINAC accelerators, the combined accelerators there are kind of coming into play with more kind of real time imaging as treatment is going on,
Yeah.
and kind of changing the dosimetric plan in the field to essentially do what we've been trying to do forever in radiation therapy is hit the target that we want and avoid healthy tissue.
Hmm.
So I think the capability of doing that will continue to get better, just treating less healthy tissue with radiation. I know there's still the whole proton photon comparison, and with the proton machines becoming smaller and smaller to where they're single room units and all these kinds of things. It's an exciting time right now in radiation therapy, and so we'll see how all those kinds of go as far as the linear accelerators are, and then how even dosimetry is being planned,
Hmm.
how how the plans are starting there. So we'll see how it goes.
Yeah, yeah, it's definitely exciting. I'd say from all perspectives, definitely.
Mm-hmm.
Do you feel? I mean, you mentioned there's a lot of machines right now coming up with different modalities. MRI, LINAC. There is the new. We've been actually. They have been thinking about. There has been talk about getting one of those PET LINAC machines.
Mm-hmm.
So it's like it's. I think the company is called the Reflexion.
Mm-hmm.
They have like a. They inject the patient with like a radionuclide. So it's a
Mm-hmm.
PET and also a LINAC. You're treating at the same time.
Mm-hmm.
With I know and this is actually interesting because I know there's a lot of different fields that when a student goes into university or allied health, etc., for radiation therapy, there's a lot of different options. You can be an X-ray tech,
Mm-hmm.
you can be a sonographer, you can be nuke med tech.
Mm-hmm.
There's a lot of division. Do you feel like the kind of interdisciplinary nature of now of modalities kind of combining things together? You have radiation therapy and MRI, radiation therapy and PET.
Mm-hmm.
How are you thinking? I mean, you're kind of at a point where you're the one who's treating with the LINAC. How do you think this? Do you think we will change? We'll need to change the curriculum a little bit of the students going into these fields, or do you think we'll need to kind of it would be beneficial to have, let's say, an MRI tech with a radiation therapist, kind of to help with the machine to see how to operate it, kind of with at least the least number of problems possible.
Yeah. I know the curriculum, like you're saying, it is pretty separated. I know a lot of some of the radiation therapists that come out. The students were kind of talking about it a few months ago.
Mm.
They do offer some CT classes, and you can kind of get a dual degree, and you can do some CT classes and then take the CT boards, so you can be CT certified. I believe it's the same. I believe I heard it's the same with MRI as well. So it's
Mm-hmm.
just kind of additional schooling, additional, continuing your education in specialized areas. I haven't looked into it a lot to where I know exactly what classes you need to take, if you need to take classes,
Okay.
or if it's more of like a on the job training that you can go and log these hours of training with CT techs or with MRI techs and then pass the boards. I'm not quite sure where that will go. My guess is a little bit like dosimetry used to be, because I mentioned earlier you could be a radiation therapist and then do this on the job training, pass your boards, and now you can be a dosimetrist.
Yeah.
Well, then it switched to you can be a radiation therapist, you can go back to school and continue education with some classes, and then take your boards, pass it, be a dosimetrist. I feel like that's probably where it's going to be going in the future. Is it may be it could be a whole curriculum change where it's added in, and maybe an additional year of school or
Uh,
whatever, or it could be optional to where you finish your radiation therapy degree or your radiographer degree and get trained in another field, CT or something like that. Um, I think it would be beneficial. It would be interesting to see the dynamic of kind of what you had mentioned. Do you have more of like a multifaceted team where you have somebody that's trained in MRI, somebody that's trained in radiation therapy, and you're working together to get this treatment, or do you have somebody that's trained in both areas? I don't know.
gotcha.
That'll
Yeah.
be interesting to see.
Yeah, yeah, yeah. That makes total sense. I know at least on the physics side, a lot of centers now are getting, even if in a red onc department, they're getting a diagnostic physicist at least on the team there to help with those, because just because of how imaging is
Mm-hmm.
getting more and more integrated into therapy.
Mm-hmm.
So I heard a lot of hospitals getting at least on the physics side, diagnostic physicist to be
Okay.
there.
Oh,
So that's kind of, it's interesting to think about it from the therapist perspective, how this is gonna change.
yeah.
Is there anything, I know we touched a lot about different things. Anything that you feel we didn't talk about, or something important you wanna mention, or any kind of closing remarks?
You kind of mentioned, is this you're going to be showing people that may be thinking about radiation therapy, just trying to get some knowledge out there. I think a great thing about radiation therapy is that it's kind of a it's a fairly easy field to get into.
Mm,
It's equivalent to a bachelor's degree, so it's not a lot of school. It's a good baseline for. It's a great career field. Like I said, there's awesome patient care aspects of it. There's awesome team dynamics. There's a lot of positives about radiation therapy. And then on top of that, just working in a hospital setting, you kind of have access to a pretty good variety of avenues that you can go. I
mm,
know just talking about a radiation therapist and kind of what they do throughout their career, there are some therapists that absolutely love radiation therapy and want to be a therapist their entire career. There are some therapists that go into the vendor side of radiation therapy and work for like a Civco, a QFix. The vendors with the machines. Maybe they go into sales. Maybe they go into customer management. Maybe they go into things like that. You can go back and get an MBA and
mm.
work your way up into administration, hospital administration. So it's a I like that aspect of the career too, is that you're not kind of siloed to one specific area.
Hmm.
You do have options to maybe build and keep learning throughout the course of your career.
It sets you up for growth, like in a different. It puts a lot of different options, opens a
Right,
lot of options for you that you can go to.
right,
It doesn't just kind of tunnel you into just this. You're gonna stay there forever. There's no room for growth.
right. Especially if you start to do kind of a multimodality. If you're radiation therapy and maybe you job train or take some classes in CT and get certified in CT, MRI, that just even opens it up some more.
Gotcha, gotcha, gotcha. Awesome, man. I really appreciate your time.
All right,
Thank you,
of
thank you,
course. Thanks
thank you,
for having
thank you,
me.
man. Absolutely.